To our top story, it is now more than 2 weeks since medical doctors walked out of their duty stations. Patients in public hospitals remained stranded, with the Doctors' Union, KMPDU, insisting no amount of intimidation and sacking threats will have them backing down. This is after the Council of Governors directed doctors employed in the counties to resume duty or face disciplinary action. In Mombasa, the medics staged demonstrations adamant that to call off the strike, all the 19 grievances must be addressed. Safina Cheng Oma reports.
The nationwide industrial action by doctors entered its 15th day on Thursday, with medics in Mombasa County taking to the streets in protest. Led by the Coast Region KMPDU officials, the doctors vowed not to heed to the directive by the Council of Governors, wanting the medics to hold the ongoing strike and resume work or face disciplinary action.
If they really want us to go back to work, they really need to heed our grievances, our 19 demands.
A whole-of-nation approach committee meeting convened to resolve the impasse hit a dead end, followed by another failed attempt by the Council of Governors, who on Wednesday failed to convince the doctors to return to work.
They cannot tell us that to go each and every county to have our different CBA signed. We have one CBA, ambayo kwamba imekuwa signed, ambayo kwamba iko legal right now, ambayo kwamba kutoka 2017 to 2021.
In Kisumu County, staff at the Jaramogi Oginga Odinga Teaching and Referral Hospital were directed to resume work by the 27th of March 2024. In his memo to the medical officers, medical officer interns, registrars and consultants working for the hospital, the facility's CEO, Dr. Richard Lesiampe, indicated that the hospital had received a memo from the County Department of Health on taking a roll call of all doctors at work. In Kisii County, the doctors blamed both the county and national government for failing to address the human resource issues, insisting that they will not be cowed by threats of being sacked for failing to return to work.
What we are telling the government is bring it on. We are willing to lose something for the sake of the profession. For the dignity of the profession, we are willing to lose our income.
The doctors have vowed to stay put, warning of mega demonstrations next week at a time when the Kenya Union of Clinical Officers, who are expected to down their tools on Monday, are set to join in.
There is a clinical officer there working in KTRH, Iranda and Marani. Every day transport from town. Anatoa wapi hiyo pesa? And then clinical officers cannot work if there is no, like now, the anesthetist cannot work if a doctor is not there. We are just there like flower girls. So, tunafuata nje mali wako, ndio tunafanya kazi.
The healthcare workers insist that they will not resume duty until all their 19 grievances, including the delayed posting of interns, extension of contracts for universal health coverage staff, payment of fees for doctors on postgraduate training, and payment of arrears of basic salaries as per the 2017 collective bargaining agreement, are addressed comprehensively.
This war is not against the patient. This war is against a government that is inept, a ministry that has shown it is not able to lead.
Safina